All right, let's dive into UTIs in kids. They're super common, but also really tricky to spot.
So your child has a fever. It's a common worry, but what if it's a sign of something more? In very young kids, that fever could actually be a silent alarm for a urinary tract infection. And they're way more common than you might think. Just look at these numbers for kids under 7.
What's really concerning? They have a high chance of coming back, 30 to 50%.
But here's the absolute key. When it comes to UTIs in kids, their age changes everything.
Simply put, it's bacteria in the urine causing an infection, either low down or up in the kidneys. In newborns, the signs are dangerously vague. They can look just like a very serious body-wide infection. For infants, the biggest red flag is often just a fever with no other obvious cause.
It's only in older, potty-trained kids that you start seeing those classic UTI symptoms we all recognize.
So, how do doctors figure this out? Well, there's a clear playbook they follow. It all starts with suspicion, but getting a clean urine sample for a culture is the absolute key. And check this out. How they collect urine and what counts as an infection totally depends on age. Treatment is also completely age-dependent. So let's walk through 3 different cases to see how. A newborn with a UTI, it's straight to the hospital. The risk of a major infection is just too high. For an infant, it depends. It could be treatment at home or in the hospital, but an ultrasound is always needed. Now, an older kid with a simple UTI, that's usually a straightforward fix with antibiotics at home. This table really sums it up. You can see just how different the approach is for each age group. So why all this caution? Why is this age-based approach so critical? It's all about prevention. Because if UTIs aren't caught early, especially in babies, they can cause permanent kidney damage.
So understanding these age-specific signs is everything. It truly can make all the difference.